Now, here it tells you that you must be caught up to here before going on. And as you go on, you see the next thing is the Parasite Program. So you haven't even reached the Parasite Program. You have just protected yourself from getting sick from killing parasites that you're going to do next.
And that's all a daily routine.
This is a daily routine.
So it means
protecting yourself, working on the carcinogen, cleaning the kidneys so that they stay functional, and feeding the white blood cells. So that's what you have to do every day to keep the program going, because what you're trying to do is to get the cancer stopped and the whole cancer healed, the organ healed.
So this is a vertical learning curve for an awful lot of people, isn't it?
Well, I think they're surprisingly good at it.
Yeah.
They're up to it.
And a caregiver is so important.
Oh yes, if there are two people getting along well with each other and determined to live, they can do it quite easily.
Yeah.
In fact, I want it to become a community health measure, so that whoever is inclined in a block or two to give out advice of this nature, it's like nutritional information. It tells you how to remove the cause of your illness. And if it's cancer, it's already been diagnosed for you. You don't have to do any diagnosis. You already know what the problem is and what you have to do. You have to get into different water, not by adding a filter. That's exactly what caused the problem. But by finding water through testing that does not have any Clorox bleach in it. Now we're up to the program. Often, if you don't happen to have any polonium in your teeth, in other words, you have a full set of dentures already, chances are that you're killing parasites left and right already just from doing this. Because you've enabled the body to take care of itself again.
And get those white blood
and
cells
the body
working.
Does it right away. You know it because you're sick, and then you have to deal with that. And usually you've gotten a little casual at that point, and may have missed 1 or 2 doses, and sure enough, you've got the flu or something equivalent. So. And at least you know that the silver lining applies to you, that you must have killed something significant in order to be sick. But then comes the Parasite Program that we have used in the past, and that is made of black walnut tincture, which you should have kept in the freezer. It won't harden, of course, in the freezer because it has so much alcohol. And cloves and a wormwood combination. Wormwood can reach the brain and the eyes where the tincture cannot very often. So in brain cancer, you would certainly want to emphasize this, and we do. And then here are the cloves. You get all this ready. And then, if you're caught up so that you can protect yourself and feed your white blood cells and take your drops, so it's generally the 2nd week where people can get caught up because their drop taking is down to 3 times a day and the load is a bit lighter. And they're used to the routine of rolling up their paper bedding and putting all their bedding into plastic bags and sending it off for testing. And doing that every other day, and taking 3 hot showers every day, or even 4, and wrapping themselves very snugly in paper, and they're accustomed to that, and they're already making lots of progress, so they're feeling a lot better.
Wow.
And that tends to motivate them.
Sure.
Then you can start zapping if you want to at this point. But I don't encourage early starting, because the more you kill, the more risk of detox symptoms, and you're already killing things perhaps at a fast clip. You don't need to be any faster, but you do have to learn how to do it. So you do that here. That's one of the projects. Then here are the rest of the supplements. Notice how few there are compared to the advanced cancer program that we had, when we were doing the 21-day program. Here you're down to just a bare handful or two.
Boy, that's a marvelous improvement.
Yes. So here you start with baking soda in water, and I often start that on the first day because people come, when they arrive, they are so acid from the ferrocyanide accumulation. Cyanide inhibits your metabolism, and you get extremely acid because you're handling metabolic acids all the time, and you can't dispatch them. You only have half a metabolism going. And then all the allergies that you have and need to avoid in your diet give you phenols, which are very acid. An allergy is a phenol reaction. So when you're extremely acid, it releases much more cyanide into your body. That's how you release it into your body, into much more toxic poison. So we don't want acid conditions. To relieve that, we use baking soda morning and night, and if it's really extreme, then we do even more than that. Half a teaspoon 3 times a day for the first 2 days is not unusual to stop the forming of so much cyanide. And of course you're drinking ozonated water at the same time to oxygenate yourself and give your body some strength to do this whole program. Then here you see thyroid supplied by the doctor, and that's once a day in the morning when you're getting up. Then before meals you take 2 vitamin B2s, 2 magnesiums, and 1 B6, and 2 Decaris, which is a roundworm killer, and also a ferritin remover. So the Decaris, you get, it's called levamisole generically, and it doesn't take very much to help the white blood cells uncoat themselves from the ferritin coating that they have, which of course disables them too. And then besides that, it's a roundworm killer, so it will kill ascaris for you, strongyloids for you, and the filaria. And we all have those. So this will be a big help. And this you take 3 times before meals. Then with your meals, you give yourself hydrochloric acid. Now you might think that, well, the body is so acid, why would you give yourself more? Because the acid has to be correct. To digest your food, you need hydrochloric acid. And hydrochloric acid will kill most of the streps and staphs, for instance. So if you're sick with colds and so on, it's the streps at work. Just giving yourself acid, hydrochloric acid in the stomach, will prevent it from getting worse, maybe clear it up.
A few drops in water?
No.
A couple, 3 times a day, or
No.
how do you do that?
No, you take 20 drops distributed on your food. You count out 20 drops, and with your plastic cutlery, you spread them. So that, because the stomach, as a rule, in an advanced cancer patient, has no hydrochloric acid. So that's why you're so susceptible to a few bacteria. Just eat 5 salmonellas and 5 E. coli's and you've got it all. They're all growing in your stomach, waiting for the next meal. Where you're supposed to have hydrochloric acid in production. And I don't know yet if that is a mutation resulting from all the mutagens and different parasites that we have, or whether it's a result of damage in earlier years when, for some reason, the stomach stopped making enough acid. And that amount is not enough to show up on your blood test, and I don't know if you can get away from that later on when you're cured. Maybe you could go down to 10 drops or even 5 drops. Usually your taste will tell you when you're getting too much or enough hydrochloric acid. You have an aversion to it then, and it's kind of easy to feel. So then you reduce it. here, the inositol on food, it is not as essential now that we know this whole mechanism as it used to be before, but it's still a very good thing for anybody with muscular problems.
Mhm.
It will, it speeds up getting well a lot.
Mhm.
The potassium gluconate also speeds up getting well.